So I am really happy to introduce Neil Jacobstein. If I were to be thorough, it would take me a long time, so I'll be brief. Neil has served as an AI technical consultant to business, to government, and defense organizations. He's a founding editorial board member of the American Association for the Advancement of Science, Science Robotics Journal. And on our website, you will find links to some of the articles that he has been involved with for that. I particularly like Neil's interdisciplinary perspectives on AI and robotics and the lens that he uses in thinking about augmented decision systems. So, Neil, we're very happy to have you with us.
Hi, everyone. I'm glad you're here. Let's get started. AI and robotics are already delivering significant value in combating pandemic disease. You know that AI is about computer-based pattern recognition and problem solving, and we've seen a lot of pattern recognition and problem solving recently. For example, from the Center for System Sciences and Engineering at Johns Hopkins University, here is their COVID-19 dashboard. This is a really important dashboard. It's been very popular, and it uses a combination of connectivity to massive data and pattern recognition. So let me just go through very quickly some promising COVID-19 applications. One of those applications is detecting weak signals of pandemic, interpreting pandemic spread patterns, sequencing and characterizing virus, searching candidate pre-approved drugs. And the significance of this is that we don't want to wait for new drugs to be going through the entire testing period, which could take years. We want to see if we can find a cocktail of pre-approved drugs that together can combat COVID-19. We want to identify good vaccine candidates, and again, we may want to use some old techniques for vaccine development and new techniques, but we want to make sure that we test them sufficiently so that we don't get unwanted side effects, or the absolute minimum of unwanted side effects. We also are using AI to simulate and evaluate containment strategies. The simulation software can be connected to a pattern recognition system, and then that AI can go through many different perturbations of control strategies for containment. We can detect weak signals of disease or immunity. There are all kinds of ways to do this. There are probably around 9 key symptoms for COVID-19, and we're just learning to see if we can detect immunity and see whether the immunity is actually something that lasts after people get the disease, and if it does last, how long it lasts. We can identify various violations of quarantine. There's a whole set of security patterns for that. And then there's also finding useful new patterns in massive data. I've collected a lot of the competitive advantages for AI and machine learning. I'm not going to go through them all here, but the most important thing is that we can augment human intelligence and expand the range of the possible. Let me just add some caveats about AI, because there's all kinds of unrealistic news stories about it. AI gets all the credit, but it actually doesn't do all the work. You need subject matter experts to organize the data and frame the problems. In addition, there are many inflated claims for AI solution, and those solutions are often talked about outside of the context of the data that's driving the solutions. And you do need data and evidence-based solutions. AI without data is just nonsense or magical thinking. You need human experts to build, characterize, and test the models. And accuracy on these models is often inflated. You can read lots of articles on the web where a group will claim 96% accuracy, 98% accuracy, but you really need to know the false positives and false negatives. So those are important questions to ask at your home institutions. You also need to keep in mind that AI may be biased because the data may be biased, and it's certainly ignorant of context and often ignorant of second and third order consequences. So what we're seeing now is that international collaboration on machine learning data sets and open source robotic designs really are accelerating progress in the field. Here's an example of progress in COVID-19. This is from the Kaggle.com website. This is an open research dataset challenge. They've pulled together a huge amount of data and made it available for free on their website. They're collaborating with a number of large institutions, including the White House and NIH and Georgetown University and others. And the key here is that this is a website that allows you not only to get access to big data, but also to join in data-driven competitions with machine learning. After a couple of decades of working in this field, I've put together an AI applications framework that encourages teams that are just getting started to develop competitive AI strategy and metrics, to use pilot projects to test your ideas, to create internal and external humans plus AI teams. The reason for an external-internal combination is you get a diversity of opinions, hopefully informed ones. Also, it's very important to provide free and application-specific training to the people who are on the team. For example, public health and epidemiology training for COVID-19 teams, and develop a sustainable AI applications community that can go beyond the pilot test. It's also important as part of that sustainability to make sure that you have champions in your organization that will defend and support your project past the pilot stage. We also want to make sure that you have continuous access to data and that you have a program for continuous improvement, which should include the use of guidelines so your AI applications can be applied responsibly. So we have built AI and machine learning systems that have narrow superhuman intelligence, but we haven't begun to create the broad, deep, and subtle intelligence that all of you have. We haven't even created an intelligence with the curiosity and extraordinary vision of a 4 or 5-year-old. So let me just mention that robotics also plays a role here that can increase the effectiveness and accelerate solutions and even save lives in the current pandemic. And I also think we're not through with this pandemic, and we may have other shoes that drop either during this period or after, so there'll be lots of health crises. And here we have AI being driven into robotics. The thing that allows this robot from Boston Dynamics to show extraordinary balance and agility is not so much the improvements in gears and sensors, but rather the improvement in the AI control system and under-actuated limbs. Just recently, I guess on March 25th, I worked with the editors of Science Robotics, and we published this article on combating COVID-19, the role of robotics in managing public health and infectious diseases. I don't have time to go through all of this, but let me just mention these 7 areas that are promising areas. And I also want to make the caveat that these are new areas for some of these applications. They're emerging areas. In some cases, in the case of, say, disinfection, very similar to painting, which the auto industry has been doing for a long time with robotics. That's not an emerging area, and robotics have been used very effectively in China and in the US for disinfection. And logistics and hospital services have been used quite a bit. Robotics have been used in delivering medications and food to people who have very deeply infectious disease. But in clinical care, there are a lot of experimental uses of robotics like venipuncture. And Intuitive Surgical has been around for quite a while. They're a successful public company, and they do limited kinds of surgery. They actually augment humans in doing surgery, but we'll see a variety of remote surgical applications, again, an emerging area. And we also have seen robotic drones delivering blood, drugs, and light equipment deliveries. And here we have the Slack application of a vat of liquid nitrogen that no human would want to stick a hand in. It's taking a test sample and putting it into a reader, and that is very, very cold liquid that a robot has no problem with. And the test sample is then put into this X-ray crystallography machine to be able to read the sample. So AI and robotics come with trade-offs. All of you know this. Yes, we get faster, cheaper, better in different problem solving, but we also are likely to see some job disruption, privacy and influence issues, as we have already seen, and some risk amplification, and to be fair, some risk reduction. What's required is that these systems have got to be managed intelligently. So I think what's needed is a nuanced, best practices approach to AI and robotics that honors the legitimate ethical, economics, and technical considerations. If we combine all of those considerations, I think we'll come up with solutions that have much better first-order consequences and certainly better second and third-order consequences. If any of you are involved in organizations that want to use AI and robotics either to address pandemics or to address the problems of your organizations, I really would encourage you to learn everything you can about these technologies, either at the education sites that I mentioned. You're welcome to contact me later. There are lots of resources that are available, and it really pays off to do your homework and try to use the best available frameworks and the best available technology advice so that your projects can be fruitful and minimize unwanted side effects. Thank you very much. It's been a pleasure to speak to you today.
Neil, thank you so much for your time and for your interdisciplinary tour, I will call it. Sharing your wide lens on AI and robotics for human resilience. Let's be sure to ask the right questions and think very critically about the outputs. Clearly, the black swan pandemic that we're in now has intensified the urgency of many challenges. That applies to health, to transportation, agriculture, education, manufacturing, commerce, everything. But it's also given us a lot of opportunities to invent the future that we want to live in.